Hey skin enthusiasts, Dr. Afton Cobb here. I'm a dual board certified dermatologist and Mohs surgeon, and today I'm going to be talking to you about acne management during pregnancy. So if you're anything like me, you have a million friends who are getting pregnant right now, everyone's having babies, it's just that time in my life, I guess, and I'm getting blown up with all kinds of questions about how to treat acne during pregnancy, what ingredients are safe. So today I'm going to do an overview of what ingredients to avoid, which ones are safe and how you can substitute it, and which oral medications we cannot use related to the skin during pregnancy. Before I get started, make sure to hit the little bell icon so you can get notifications anytime I post a new video, and hit the subscribe icon so you can stay tuned to my YouTube community. Let's dive in. Okay, so the first thing that I'm going to talk about is what happens with acne when you're preggers. And so generally speaking, when the hormones in the body are imbalanced so that there's more androgens or male hormones, that's usually what makes acne worse. So therefore, usually in pregnancy, because you have higher estrogen levels, your acne generally should get better. However, I would say that despite that, I see people all the time who start getting breakouts during pregnancy that never had acne before. And so part of that is just the changing hormones. The skin doesn't like fluctuations. The skin likes consistency. So that's why you might notice when you're pregnant that you get more breakouts. So what happens when you're getting all these hormone shifts is that the oil production, the sebum increases, you can get more clogged pores and more breakouts. This tends to happen more in the first and second trimester, so you might also notice that as well. So we're going to dive into how to manage acne during pregnancy. I'm hearing all the time from all my friends how tough the first trimester is. They're feeling nauseous, they're feeling unwell, and really the last thing that you want to have to be worrying about with all this other stuff happening and big life changes coming up is your skin and your acne. So we're going to dive into what kind of things you can do for your acne management during pregnancy. So I'm going to start first by talking about what oral medications related to the skin should be avoided while you're pregnant. So sometimes we use vitamin A derivatives like retinoids to treat acne, and the one that everyone knows by the brand name is Accutane, also known as isotretinoin. And the reason why you have to avoid that during pregnancy and even for a month after you finish Accutane is because vitamin A is very crucial to the developing baby. And so if you give really high levels of vitamin A, the fetus can't mature in the right way and you can have a baby born with birth defects. And so because of that reason, there's a whole government monitoring program called iPledge, in which women have to come in every single month and get a pregnancy test to make sure they're not pregnant. They have to wait a month in the very beginning before they can even start to make sure that they're not pregnant. And they have to make sure that they're being either abstinent or have 2 forms of birth control while they're on the medication. And this is a really well-known thing that happens with vitamin A, so that's why oral retinoids such as Accutane are completely contraindicated during pregnancy. And later on I'm going to talk about how this relates to topical retinoids, because those are related as well. The other oral medicine that we frequently use in dermatology to treat acne is antibiotics like Doxycycline. So Doxycycline is also not good for the developing baby or even for small children, and it can affect how the teeth grow. Doxycycline can affect bone and dental development, and so for that reason, doxycycline is not recommended during pregnancy. There are some rare circumstances with severe diseases where the benefits of using doxycycline during pregnancy might outweigh the risks, such as like a severe rickettsial disease or something like that, Rocky Mountain spotted fever. But in general, doxycycline is not recommended during pregnancy, especially for acne, because we have other options that we can use. In addition, doxycycline does get passed in small amounts through the breast milk, and so it's not recommended to take doxycycline while you're breastfeeding, because if you take the doxycycline for longer periods of time, it can pass on to the baby and can also cause potential problems with bone and dental development in babies as well. But that's mostly more for longer courses of doxycycline. Generally, if you had to be on a short course of it, your baby would probably be fine while you're breastfeeding, but if you can, you want to avoid it. One of the other medications that we use in dermatology to treat acne is called spironolactone. Spironolactone, the way it works, it's actually a blood pressure medicine, and then they started realizing that people were getting gynecomastia, like enlargement of their breasts, while they were on it, and that's how we discovered that spironolactone has anti-androgen properties, so it kind of balances out, brings down the male hormones, and that's why it can help with acne. And this is another one that you would not want to be on while you're pregnant. One of the main concerns is that if you're pregnant with a male fetus, it can feminize the fetus, and so this is another one that you would want to avoid during pregnancy. So for women who have pretty severe acne, and by that I mean if they're having cysts and really deeper seated big pustules and nodules, it can be challenging to manage acne during pregnancy, because a lot of times those patients need to have an oral medication to help calm down the acne, and a lot of the ones that we typically use you can't use during pregnancy. In those cases, you'd have to consult with your dermatologist to come up with some alternative options. What I might do is think about different antibiotics that we could try that are safer during pregnancy, or potentially even using things like light therapy or doing intralesional steroid injections into individual cysts to try and keep it at bay, with the intention of later on down the road using some of those systemic medications to get it under control at a safer time. Okay, so moving on to topical things that you might want to avoid during pregnancy. So the first one I'll talk about is topical retinoids. So, topical retinoids, vitamin A derivatives, this is like your Retin-A, your adapalene or Differin, those kind of things, even over-the-counter retinol. And technically, you should avoid these during pregnancy. That is for sure the safest thing to do. And that's because of what we know about what I was talking about earlier, where vitamin A can, if in very high doses, can disrupt the normal maturation of the fetus. Now, I will say there isn't really any evidence out there that the topical retinoids have caused problems. So is it the end of the world if you were accidentally using it and then realized later that you were pregnant or something? You'd probably be fine, but when making a decision about what product to use on your skin, it's safest to avoid topical retinoids. Another thing you might ask is, what about Bakuchiol? So Bakuchiol is coined as this alternative retinoid, and because there hasn't been any studies or evidence to show that it's been harmful to a developing fetus, some people say Bakuchiol is a safer alternative to retinoids than any of the other retinoids. However, I would say there's a little bit of a caveat on that. It's a newer ingredient, so we just don't really have that much data about it yet, and it does work mechanistically through a lot of similar pathways as topical retinoids, so I would still be a little bit careful about that. It is different than vitamin A, but it does still work on a lot of those pathways. So in the abundance of caution, I would probably just avoid Bakuchiol personally myself. Again, if you happen to be using it and you didn't realize for a while that it was not okay or whatever, you'd probably be fine. But in the spirit of making the best choices, I would just avoid it. One other interesting thing to talk about with topical retinoids is that there's a newer topical retinoid called Trifarotene or AKLIEF, and this one's a little bit interesting because it is a fourth generation retinoid that binds more specifically to the receptors RAR-gamma, RAR-gamma, and those receptors are found less frequently in the placenta. So some people think that if you were to use a topical retinoid during pregnancy, that this Trifarotene or AKLIEF is safer because it's binding specific receptors that are not as present on the placenta, so there may be less absorption through that. So jury's out on that a little bit, but an interesting thing to know. The next topical product that you'll hear about to avoid is salicylic acid. So salicylic acid is another one of those slightly controversial ones because generally in smaller amounts, like smaller concentrations, and in things like washes where you wash them off and they're not sitting on your skin for very long, it's probably safe. Things that you would want to think a little bit more about would be like if you did a salicylic acid peel that was a higher concentration, or if you put a leave-on salicylic acid product that might have more time to absorb and penetrate into the skin. That would be a little bit more potentially more concerning. Salicylic acid has the caveat for pregnancy because oral salicylates like aspirin are contraindicated during pregnancy. However, in topical formulations of salicylic acid, it's generally considered safe. So if you're looking for alternative products to use topically on the skin during pregnancy for your acne management, there's a couple things you can consider. One would be benzoyl peroxide. This can be found as a wash, as a spot treatment, as a leave-on, and that is safe during pregnancy. You could also consider using glycolic acids like the AHAs, and those are safe during pregnancy. They can give you a little superficial exfoliation, and that can help with acne. You can also try azelaic acid, which is a great option during pregnancy. It's fairly gentle, and it can help with acne as well. Or you can see your dermatologist and see about potential prescriptions. Things like topical antibiotics like topical clindamycin might be a better option during pregnancy to avoid any oral antibiotics, and can help with inflammatory acne like the red pimples and pustules and stuff like that. One other option that could be really nice for pregnant women dealing with acne is light therapy. And there's two different ways that we think about light therapy. One, you might think of those home LED devices that you can get, and then there's also light therapy in the office with a dermatologist, and that's called photodynamic therapy, or PDT. So PDT in the office is a method where we put this chemical on your face, you sit there for about an hour, let it soak in, and then you go under the light. And that can definitely help with acne. There's not a whole lot of data though about whether it's safe in pregnancy to put that chemical on your skin. So I would be a little cautious about that, and if you're interested in that, I would talk to your dermatologist about it first. But the other options are the visible light, LED lights that you might get over the counter or something. And blue light does help with acne. The way blue light therapy works is that it targets a bacteria in the skin that causes acne. So the bacteria in the skin that causes acne is called propionibacteria or cutibacteria, and that bacteria produces things called porphyrins, specifically the coproporphyrin 3. Whew, mouthful. And that porphyrin has an absorption spectrum peak at 415 nanometers. 415 nanometers is the wavelength of blue light. So what happens is when you put blue light on the skin, it excites those porphyrins, and which are in the bacteria, and destroys the bacteria that causes acne. So that's why blue light can work well for acne. It's obviously going to be a little less effective if you're using just the home devices, but it's something that you could definitely consider to help improve the acne. And red light therapy might work as well. It's a little bit longer wavelength, it penetrates a little bit deeper into the skin, and it works by exciting the mitochondria and kind of creating increased energy in the cells in the skin, and that can also help with acne. So that's definitely something to talk to your dermatologist about if you're struggling with acne. As always, you want to make sure you're doing good sun protection with sun protective clothing and sunscreen, especially if you have problems with acne, because what can happen is you can get post-inflammatory hyperpigmentation, so like discoloration of the skin and the scars, and when light hits that from the sun, it can cause darkening of the scars and of the hyperpigmentation, and that can make the skin look less nice as well. So doing good sun protection can also help to make your skin look a little bit more even and clear, even if you're struggling with acne. And when choosing a sunscreen during pregnancy, I would opt for the physical blocking mineral sunscreens, such as those that contain zinc oxide or titanium dioxide, and those are very inert. They sit on the skin. Zinc is even helpful for a lot of things, even if it was absorbed in the skin, but those are a safe option during pregnancy. Some of the chemical sunscreens, such as oxybenzone, there's some concern out there about endocrine disruption, which you wouldn't want while you're pregnant, but again, the amounts of that are probably limited absorption. If you like happen to put some on your face a couple times, probably not going to make a big difference, but when choosing a sunscreen, I would recommend choosing a physical blocking sunscreen with zinc or titanium. All right, well, that's all I've got for you. I hope that was helpful, learning a little bit about how to manage acne during pregnancy. If you have any questions, feel free to drop a line in the comments. And if you like this video, make sure to hit the like button, share it with your friends, and don't forget to subscribe to my YouTube channel so that you can stay tuned with all my new videos. Thanks.